again, and welcome to our latest installment on supply and demand in healthcare. As you may remember, we're talking about queuing theory and how it applies to overall capacity management and patient demand. And as we talked about last time, understanding how patient referrals and increased retention impact your target point. So there's this point where as you care for more and more patients, you reach your capacity, your ability to provide care, while also managing outcomes and patient safety. And as you've increased referrals and retention, you've also increased variability and volume. And what that means is that the line has moved to the left. It's gone up and to the left because you have the variability and the volume again. So you as an organization, if you keep this up, your patients are not going to stick around, right? They're going to have increased wait times, they're going to have decreased satisfaction. All of a sudden, all that work that you did to increase referrals and retention has gone out the window. So how do you bring this target back in line with your goals? Well, there are a couple of things that you can do. One is really with standardization. And when you can standardize your workflows, either standardizing your order sets or standardizing your patient access workflows, standardizing your billing processes, you can start to get that variability moved out of the system and you start to bring this line down. At the same time, we can start to look at how do we increase capacity. So when you talk about increasing capacity, you can't always buy more doctors or increase the number of beds that you have. Or you can start to look at your schedules, your provider schedules. How do you maximize the number of visits that you can fit in those schedules and the visit types that are available? And how do you maximize the number of beds and how you're using your inpatient beds? Well, as you're maximizing this capacity, what you're effectively doing is you're no longer operating at 100%. Maybe you're up at 125% because you've increased your capacity by 20%. You've increased the number of visits you have, or the number of, maybe you've reduced length of stay. Well, when you increase your overall capacity, well, that's going to bring this line back. And so as you have increased your capacity and you are standardizing your workflows, you're able to get back to your target and reach that point where you have a good handle on your satisfaction, your outcomes, and providing care to the number of patients that you know you want to care for. And that's going to help keep you in balance. So we have a lot more material on the website that talks about how you can manage your capacity, talks about how you can increase your referrals and standardize your workflows, and ask that if you're interested, you go take a look at those. And thanks for your time, and see you next time.